Middle Township is not immune from the heroin and prescription epidemic that is facing our state. We are here today to announce immediate steps that we are taking as a community to address this issue. I will first share with you some statistics. As noted in the Governor's Task Force report on heroin and other opiate use released earlier this year, there were over 8,300 admissions to state license or substance abuse treatment programs due to prescription drugs. This is an increase of 200% from the previous 5 years. Even more alarming was that 40% of opiate admissions involved persons under the age of 25. In Epidemic County in 2013, there were 104 overdoses and 25 deaths. In Middle Township, the number of cases involving heroin and/or prescription drugs has been increasing steadily. Year to date, we've had 202 cases. Same time period, 2013, 183, and in 2012, 158. This just scratches the surface, and these are numbers that we know of have a connection based on our reports. Overdoses. Year to date, we've had 20 in Middle Township. Same time period in 2013, 18. Same time period in 2012, 6. Facing this increasing and alarming trend, we have decided to take action. We will not wait for the federal government or state to pass legislation to deal with this issue. The centerpiece of the actions we are announcing here today is the Public Advocate Program, which will begin this Thursday in Middle Township Municipal Court. We have partnered with Cape Assist, who will provide a trained drug counselor/preventionist in the court every Thursday. We will be the second municipality in the state to put a drug counselor in the court. This past summer, Gloucester Township announced a partnership with Genesis Counseling for an advocate in their courtroom. As of last week, there were 24 individuals that were receiving active treatment after making contact with the advocate in their municipal court. There's been a shift in policy that emphasizes treatment for nonviolent drug users. The governor has announced the expansion of drug court, which is a terrific idea. However, municipal court is missing in the equation. To be eligible for drug court, a person must be facing a crime. If you look back 5 years at individuals that were accepted into the drug court program, you will see they were in and out of municipal court for years, and there's no mechanism for treatment options in municipal court. I think we would all agree that the earlier you can intervene with a person suffering from addiction, the higher the likelihood of success. The cost of the program for the remainder of the year will be approximately $3,600. We believe it's money well spent, and I commend and thank Mayor Donahue and Township Committee for stepping up and recognizing this and funding the program. In addition to the Public Advocate Program, we will be taking the following actions. First, Middle Township will submit an application to participate in Project Medicine Drive, and it will be located in the lobby of the Middle Township Police Department. We have always collected prescription medication in the past from residents, but a police officer would have to come in off the road, and this could take a few minutes, more than a couple of minutes, depending on how busy we were. When we receive this new box, all residents will have to do is come into the lobby, drop the medication in the box, and leave. That's it. Second, all Middle Township police officers will be provided with quick reference cards that were produced in partnership with Cape Assist. These cards can be provided to members of the public that we encounter in the course of our duties that may be experiencing not only issues related to addiction, but are in need of other services related to domestic violence, mental health issues, or family counseling. Third, we have requested the Cape May County Prosecutor, Robert Taylor, present his award-winning program, Pills to Heroin, to all school districts operating within Middle Township. There is no silver bullet to address this very complex issue, but we firmly believe that these initiatives will make a difference here in our community of Middle Township. This time, I would like to call forward Mayor Donahue.
Thank you, Chief. We want to thank everyone for coming out today to hear about this new program and speak about this very, very important issue. I think you would have to have your head buried in the sand to not realize that this issue with addiction, from prescription drugs to heroin and everything in between, has become an epidemic in our county, and it's a shame. And I think the steps we're taking here today, emulating this program, has been very successful in Gloucester Township, are a big step to interdicting in this process before it becomes a major criminal issue, to get to these mostly young people at a time when they are salvageable, when we can bring them back. They know there are avenues for them to explore. The chief said that there is no mechanism here at the municipal court level to address these concerns. At the Superior Court level, there is. And the drug court has been very successful. We certainly support that, but I think what the chief's main point was, we need a multifaceted approach to this problem. And this is going to be a tool, I think a very important tool, once people hear about it, as a way out, a way to avoid the criminal justice system. People are crying for help, they don't know where to go to get it. We will have that advocate, and I think it's a great day for this person to be here not only for these the offenders, but also for their families who need so much help as they try to deal with this. So I want to applaud the chief, as always, and his department for being innovative, for being proactive, for taking an approach that maybe cuts against the grain a little bit. And I know how hard the chief worked to get this in place and talk to the courts and the administrators of the courts to make this happen. And it was touch and go for a while. So I give him and his department a lot of credit for sticking with it. We look forward to it starting this Thursday. We're very, very happy to have Cape Assist as our main partner in this. Their track record is second to none. So having said that, I'll introduce Lynn Krakowski from Cape Assist.
Well, he kind of stole my speech because I want to say innovative, proactive, and intervention. Those are the key words to these programs, and it's very important. It'll be cost saving, it'll get people help sooner, and we're very proud to be a partner with the police department and Middle Township to do this. Thank you.
Prosecutor Taylor?
Thank you. Good afternoon. I'm here to talk about our Pills to Heroin program. First, I'd like to commend Chief Lusner and the Middle Township Police Department for their efforts. They've been partnering with us for 10 years. I've been prosecutor on a lot of our initiatives, the Pills to Heroin being the most recent one. I want to thank Lynn Krakowski. I work with Lynn year in and year out at a variety of various different programs. We were at the Healthy Community Breakfast this morning with her. So the folks at Cape Assist really do an outstanding job here in the county to help out. The Pills to Heroin program that we started is something designed to keep young people from trying heroin. It's so bad in Cape May County, we have drug dealers that are approaching 12 and 13-year-old students offering them heroin. And why I say pills to heroin, a lot of people don't know that kids get started by getting Percocet or some other opiate out of their grandmother's or father's or mother's medicine cabinet because people are not keeping track of their medicine in the medicine cabinet. And once the child gets addicted to the opiates and the Percocet, they start running out of money. They use up all their allowance, they sell their iPhone, they do all those things to raise money to buy the drugs, and a Percocet costs $1 a milligram on the street. So it doesn't take them long to run out of money, and next thing you know, you have a drug dealer offering them a bag of heroin. A bag of heroin in Cape May County is so pure, children can become addicted or overdose on one usage. That's how pure it is in Cape May County. So it's important for all of us to not only talk to our friends, our neighbors, our nieces, nephews, our children, and we're going out with Cape Assist help. I serve on the Pride Committee with Lynn, and we meet once a month discussing this issue. We've already been out to some of the high schools, but we're going to go out again this fall, and we're also going to go out to the middle schools, because believe it or not, the kids in 6th, 7th, and 8th grade are some of the biggest targets for the drug dealers. So our program is a good program. It's very enlightening, and it's also a little bit scary. If you look at it and the kids see it, they get a good dose of what may happen. And I'll just say one final thing. We've presented the program to the entire student body at Wildwood Catholic from 9th grade up to 12th grade. We got a lot of good feedback from them. We got emails from them, calls to our narcotics task force asking what they should do and how they should do things like that. And I'm getting ready to start a program, hopefully, with Chief Lusner where we put stickers inside the lockers in the high school where kids can anonymously get a hold of the police department or my office and let us know what's going on. If they see drug dealing going on near the school or in the school, they can just click on this and anonymously let us know what's going on. So I thank you all for being here today, and I want to commend the chief for the job he's doing.
Deputy Mayor, you want to say anything? You're good?
I just want to say thank you to the chief and to the police department for all their hard work and everything they did to spearhead this. And I'm really proud that we're going to be able to offer this to our residents in the municipal court.
Okay, we'll stick around in case anybody has any questions. Thank you very much for coming.